Now I want to talk a little bit about headache pain. So a good massage therapist has already had them face down or prone, and they've done a really good back, neck, and shoulder massage. And so the client is face up. We're in the last 10 minutes of the session, and we definitely want to target some muscles. Now, the muscles we're going to be working on are going to be the neck muscles and the shoulder muscles that come up to the occipital bone. Sometimes we call this the occipital ridge. It's the area between the spinous process and the mastoid process on both sides of the body. And we're going to be working a little bit in the cervical area and a little on her temporalis and frontalis, and then we're going to hit some sinus points here. The first thing we're going to do is just kind of say hello to the neck and shoulder muscles. One of my favorite moves that I learned in a workshop is we call it a cranial base release. And you start with sliding your fingers up the neck. You're going to contact the points along the occipital ridge. Now, because she has long hair, and since I don't like my hair being pulled, I'm sure she doesn't like her hair being pulled. So I'm going to come up, get some of the hair, and come back down, so I've released all the tension. So what I'm going to do is I'm going to rest my wrist on the table. So this is very little muscular effort on my part. And I'm going to lift my fingers, straighten my fingers to where I'm contacting the tissue just beneath the occipital bone and along with the suboccipital muscles. And my fingers are pointing toward the ceiling. And more than a massage, this is more of a hold of the tissue. And at first I cannot feel her cervical vertebra, but as she relaxes more, there you go, thank you. As she relaxes more, I can feel the vertebra with my fingers. Now, you can hold this position for a few moments, up to several minutes, depending on what kind of tissue release that you're getting. After a while, you're going to curl your fingers, and then the direction of force is not toward the ceiling, it's back toward you. So this is kind of a decompression of the cervical vertebra. It's also a lengthening of the neck, and I'm still contacting those suboccipital muscles here and applying some nice traction. And again, this is not a massage per se. I'm not moving tissue. I'm just maintaining pressure and direction. A lot of good massage technique is about the direction that we're going. So here in review, we're going straight up, and already she's feeling a little softer back here. Also remind your client to make sure that their teeth are not touching each other. And because of gravity, her jaw should almost feel like it's falling down and back. Very nice, very nice. And again, pulling, relax a little bit more. I'm going into the traction move now. Depending on the level of her release, some people can feel it just beneath the pull, but some people can actually feel this all the way down to their sacrum. Okay. So once this tissue is nice and released, I like to turn the head to the side. And I want you to notice this is a lubricantless massage. I'm not using any massage lubricant. You can do circular friction in that, what I call the lamina groove. It's the groove that's created by all the cervical vertebrae stacking on top of each other. And it's the groove between the transverse processes, which now that I've turned her head, they're here, and the spinous processes, which are here. So it's just this little bitty pocket of tissue, but a lot of wonderful muscles live there. So I'm going to be doing some circular friction on those muscles. When I get to the suboccipitals again, I can do circular friction on those, and then I like to do a scooping down at first. And again, I'm not sliding across the skin, but I'm contacting the skin and moving it down. And then I'm reversing that direction, so the scoop then is from down to up. Very nice. And again, I like that movement element of her head and neck. So a lot of this facilitates that. So working in that area here, I'm going to rotate her on the other side. And so first, we do a nice little stretch, and then I'm going to work again in that lamina groove, with circular friction. And of course, I'd be doing a whole lot more time if I were doing it as part of her massage ending. Now this time, I want you to notice I kind of pulled her before I started the circular friction, so we can get a little bit of a traction along with the nice little working of those tender areas, and I do suspect that they're tender. Am I right about that? Yeah. I can kind of feel some tension here. So I'm scooping again, and it doesn't matter how you do this. You could do this in any sequence that you want. You can start with the scooping, you can go back to the scooping or the circular friction. Just the main thing is to get the tissue releasing. Now what I'm going to do is I'm going to take my thumb and I'm going to treat it like a fulcrum point, and I'm going to kind of rock her head back on my thumb, kind of trying to get some movement back in those little bitty facet joints in the cervical vertebra. Nice and easy, relax a little bit more if you can. There you go. And you can stop and do some targeted work with the circular friction, which I know that she needs. And then going back, just trying to introduce some movement. You can do the scooping motion too, bilaterally or unilaterally. So I'm doing that scooping motion again, but again I'm working on both sides at the same time, and it feels really good back there. Does that feel better to you? Okay, then what I'm going to do, we must pull, and you can even get a grander pull by using your thenar eminences or your thumb pads right underneath the zygomatic bones, and then pull and in the neck. Then I'm going to I'm doing this on both sides at the same time. Some circular friction on her temporalis. Now this time, I want you to open your jaw, like you're yawning, very nice, and close. And you can have them clench. Go ahead and clench for me a little bit. Good. Change it. Then I'm going to her frontalis, and here I like to support the base of the skull and apply a little bit of traction. And then I'm going in with just some circular friction on her forehead. And you can slow down on this if you want to, or speed up on this, just whatever you want to do. This should feel pretty good. And then when you do the sinus points, the chief point is on the corners of the nose, kind of below the eyes. So I'm going to find that point, and again, this is one of those things where directions are very important. I'm going to slide down the sides of her nose, place my fingers where I think the spot's going to be, but she's going to tell me if I'm on the right spot or not, because it's going to be a little uncomfortable. I'm going to go down and up to her eyes. Is it tender? Okay, so the thumb going up. So you can do vibration, you can do circular frictions, or you can just do static pressure. It really doesn't matter. But this is the main point, but I'm not going to stop here. I'm going to continue working under the cheekbone or zygomatic bones. And you can hold it for 3 seconds, 5 seconds, it really doesn't matter. Then I'm going just above where I was. So I'm just on top of the zygomatic bones. Are you wearing contacts? Okay. And I'm going to go end up about on the temples. I'm going to use my thumbs now and going above the eyebrow, because you also have sinuses in the frontal bone. You have 4 pairs of sinuses. I like to hit this little notch called the supraorbital notch. And then I'm going to very lightly, this is just more of a fun move, not a really therapeutic move. I'm using my middle finger, and I'm just touching her closed eyelids. And then you can just say hello to the shoulders. Pulling. You can move up again on the neck. Just relax as much as you can. And then you can end up with that cranial base. Really smooth. So I'm hoping that this demonstration gave you some other techniques to do on your clients who have headaches, suboccipital pain, sinus congestion, and enjoy massaging.